Good afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Wednesday, July 8th. We are joined today by the Minister of Community Services, John Streicker, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. We also have with us André Boursier from French Language Services Directorate, who will translate any questions from French-speaking journalists, and our sign language interpretation is being provided today by Mary Thiessen. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Minister Streicker?
Thanks, Pat, although I thought today that it
We're
was
going to start with Dr. Hanley. Dr. Hanley. My apologies.
Oh, what a surprise. Well, good afternoon. Thank you, Pat. And bon après-midi. Today already marks a week since we entered phase 2 of Yukon's plan to reopen. Of course, it's early, but so far, so good. It's easy to watch the news from elsewhere, even in Canada, but especially the US and other parts of the globe, and focus on many of the negative events as a result of opening up in the face of community spread. Crowded beaches, overflowing bars, rapidly mounting cases, and people not respecting physical distancing directives. It certainly could lead to a worry that we might see similar increases happen here. But overall in Canada, of course, we're doing well. And in Yukon, we're opening up in the absence of community spread and in the context of sporadic cases with no current active cases. With the measures that we have in place that we're continually working on to improve, we should stay in a positive position where we can act, respond to manage cases or outbreaks, and stay ahead of community spread. I continue to get emails and phone calls every day about people who are not following the Safe Six, about Americans who appear to be straying from the travel corridor as they were advised, or people worried that they may have had contact with someone from outside the territory. There are even photos being received of out-of-territory license plates from people who are concerned that these visitors will bring COVID back to Yukon. Well, I do want to continue to emphasize that we have measures in place to allow residents to stay safe. And while we are continuing to work to keep American travelers on the straight and narrow, a brief encounter with them in a grocery store or at a gas station is unlikely to lead to transmission of COVID. After thousands coming through, we have not seen COVID transmission from these travelers. But you can all help to minimize the risk by maintaining all the preventive measures. Washing hands, maintaining physical distancing from anyone not in your bubble, staying home when you're sick, traveling respectfully. And that'll help us to stay okay. We reopened a smaller version of the RAC, or Respiratory Assessment Center in Whitehorse, on Monday in order to ensure that we have a central, easy-to-access location for people to get tested should symptoms occur. Currently, the hours for testing are 10 a.m. to 4 p.m. Monday through Friday. We'll continue to monitor the demand and adjust spacing and testing options accordingly. A little bit about hospital visitation and the BC bubble. In general, of course, with the so-called BC bubble, we do not consider BC to be a high-risk area. But for some of the purposes of protecting our facilities from outbreaks, such as long-term care and Whitehorse Hospital, and for healthcare providers, we do still consider travel to BC a higher risk event. So, for example, Whitehorse Hospital still considers BC a high-risk area. Individuals who travel to BC or who are a close contact of someone who travels to BC and comes back needs to be aware that that may affect elective surgeries or procedures if certain conditions are not met. So, for an example, someone I know is waiting for cataract surgery, and if she were to get a call to come in for surgery in the next 10 days, but her partner had traveled to BC within the previous 2 weeks, it's possible that the surgery would have to be postponed. So if you do have an elective procedure booked, please don't travel outside of the territory, or at least phone and check what the requirements will be before you plan your travel. We've always said, I've reiterated that opening the border carries a small risk. It's not without risk, and although we believe that risk to be small, we want to maintain that protection against introduction of COVID-19 into healthcare facilities. We know that outbreaks do occur, such as the one currently in Alberta in an acute care facility. So there will be, people are traveling, people are looking to outside travel, and I think we again have that opportunity now to travel within that bubble of BC and our other northern territories. And as for other jurisdictions, that's something that in time we will be able to address. But again, to emphasize that this is a time to travel within Yukon as well, as many people are experiencing. We know the campgrounds are exceptionally busy. And Alberta Tourism put out in their advertising, Alberta will still be here next year. And I think that's kind of a good example to how we can think of maybe destinations that we have our eye on for tourism or visitation purposes, but maybe need to put that off for the time being. For looking ahead now in the months to come. So if we go back to March, when this all began, we really didn't know what lay ahead. We had no roadmap, no common set of instructions. And when we were planning our actions, we had to watch, see what was happening elsewhere in Canada and around the world. We had to take cues from those who were ahead of us in tackling the myriad dilemmas posed by COVID-19. And even those places we were looking at were themselves in midstream and having to make decisions. There was no clear indication of what was right and what wasn't, what worked and what didn't. But like the rest of the country, we had to act quickly and decisively. Thus, the series of advisories, recommendations, and orders that started in late March. And now, what in pandemic time seems like an eternity later, but in fact is only a matter of a few months, we're well on the road to reopening with good results so far. Again, we maintain that line that perhaps no one is completely happy with, but at least strives to maintain the balance. Not too fast, so as to take on too much risk from a disease that continues to teach and surprise and sometimes devastate. But not so slow, so as to smother any chance to bring back some vitality to our society, to relieve mental health and stress and access to health services and financial distress, for all of us to breathe a little and enjoy more of life. We're well positioned to continue the reopening of Yukon and anticipate the next phase. As I mentioned a week ago, we entered phase 2 with the opening of our borders to BC, NWT, and Nunavut, without the requirement for those individuals to self-isolate if they come straight to Yukon from their home jurisdiction. Our intent that started in phase 2 was to safely start to ease public health measures and prepare to ease border control measures. With the way things are going, and if they continue to move in this direction, I have discussed with the Premier the feasibility of moving to phase 3 by August 1st. If we continue to do well, the Premier will confirm these plans in 2 weeks' time. At that time, more details will follow of what phase 3 means. But if you check the Path Forward plan, you'll see that phase 3 will be our so-called new normal and will focus on long-term sustainability and living safely with COVID-19. Phase 3 is a time where we will look at the advisability of further border reopenings as we lessen the enforcement presence at the border, based on numeric criteria, including stability of the COVID outbreak in other jurisdictions, and our ongoing capacity in health and public health. We will then be able to phase in other easements of the self-isolation requirements. Phase 3 is also the time where we can adjust guidance for gatherings, facilities and events and activities, all based on the best evidence we have available at the time, other jurisdictional practices, community and stakeholder engagement, and feedback from the current state. The Public Health Agency of Canada and my fellow Chief Medical Officers of Health are all working to advise on what our new normal will be. It's clear that as long as COVID permits us to carry on, that we cannot keep ourselves in lockdown. Although a reintroduction of restrictions is always possible if things do not go as planned, my plan is to move ahead with as much prudence and forethought as we can to prevent having to go backward. As we look to phasing in from phase 2 to 3, we will be keeping watch on the surveillance information from other jurisdictions. Are numbers going up or down? How does that affect the risk of importation of COVID to Yukon? We're developing an importation risk assessment tool that will, along with our usual avenues of knowledge and actual border activity, help us to determine that risk. In the Path Forward document, Phase 3 is called the new normal. It will be the phase we will live in for many months, possibly years to come, until a vaccine is developed or treatment methods are improved sufficiently to downgrade the threat of COVID. The pressure remains on us, and I can't stress again enough the importance of taking responsibility for our own actions as we continue to move forward. Significant investment has been made in keeping us all safe. Governments, both local, territorial, federal, First Nation, businesses, faith groups, and sporting groups all have taken steps to ensure that their activities or activities within their sphere will not further endanger individuals. And we now have to continue to do our part by not only practicing the Safe Six, but by integrating them into our collective way of life. Thank you. Merci. Merci, Joe. That's all for my update. Minister Streicker.
Thank you, Dr. Hanley. Good afternoon, everyone. Bon après-midi. It's good to be joining you again today. I want to start by thanking Yukoners for continuing to practice the Safe Six, our necessary steps to living with the reality of COVID-19 and preventing its spread. We've said this before, but it's worth mentioning again that the low COVID-19 case numbers in the Yukon are a direct result of the actions we have all taken working together, and it's our continued vigilance that will keep them that way. Reopening our borders with the rest of Canada does change the risk of potential cases entering the territory over the coming weeks and months. It's crucial that we don't become complacent as we move forward to a new normal. Washing our hands is something we control. Staying home if we're feeling sick, physical distancing, skipping that party because you're unsure how many others will be attending are all things we control. And protecting ourselves protects others. Even if you believe COVID-19 poses no threat to you, doing your part protects your loved ones, friends, neighbors who might be more vulnerable. I'd like to turn to providing some updates on our border measures. On July 1st, around 250 British Columbians entered the Yukon under our new mobility bubble. Yesterday, 1 week in, a little over 100 BC residents arrived. As we proceed with our reopening plan, I anticipate that we will continue to maintain a presence at the border and Whitehorse Airport into the fall. This includes continuing to require appropriate identification, contact information, and a declaration for every individual entering the Yukon. We want to ensure travelers understand the requirements for entry and their obligations and responsibilities. The information we gather also supports Yukon communities. It does support Yukon communities. It also supports Yukon communicable disease control in conducting disease surveillance and allows for contact tracing if necessary. It also allows us to make sure that if we receive a report that someone is not sticking to their travel corridor or self-isolating when they are supposed to, our enforcement officers can and will follow up. Last Friday, excuse me. Last Friday, a fourth charge was filed under CIMA. A ticket was issued for 2 Canadian residents who were found to be non-compliant with their declared purpose of transiting through the Yukon. They were required to leave the territory, and they have left. I do want to reassure Yukoners that these individuals did not show any symptoms of COVID-19 on their entry, nor on their departure from the territory. We take reports of non-compliance under CIMA very seriously, as well as the feedback we receive from Yukoners. We continue to look at ways to improve compliance through information and education. We're grateful for the support that we receive from the City of Whitehorse, where bylaw officers have been monitoring vehicles that may not have complied with CIMA direction and are reporting this to CIMA enforcement officers. They drive through box store parking lots and pass across American license plate information to us. However, I want to make it clear that just because you might see a vehicle with an American plate in town or in a park, that doesn't mean it's violating CIMA orders necessarily. Some neighbors from Alaska do come to the Yukon to provide essential or critical services. I'd like to emphasize that our COVID-19 response measures have been effective. Again, the best defense that Yukoners have against COVID-19 is our shared responsibility to practice the Safe Six. This has proven effective with our neighbor, British Columbia, and is a defense that we can all take ownership of. Yukoners work so hard to make sure Yukoners have worked so hard to make sure the restrictions have been effective. Yukoners have stayed home, canceled travel plans. We canceled hosting the 50th anniversary of the Arctic Winter Games, and we postponed celebrations. This effort has not come without a cost, and I think all Yukoners can appreciate that these sacrifices are for the greater good. In response to the impacts of these preventative and cautionary measures, our government has created support programs for Yukoners and businesses. We allotted millions of dollars to help counter the impacts of this global pandemic. We know that the impacts of the pandemic are still being felt. To help Yukoners, we have introduced a number of important support programs like the Rent Assist program. Today, I'm happy to say that we are extending that program until September. That means Yukon tenants can apply for rent assistance that will cover up to 50% of their median rent. If you are in need of this assistance, please reach out to Yukon Housing, and they can give you the application information. I would also like to remind businesses that they can still apply for the Yukon Business Relief Program. If your business, including home-based businesses, has been impacted significantly by the pandemic, our team at Economic Development is available to help with the application process for that program. Information about all of the government support programs are available at yukon.ca. I want to reiterate that we hear your concerns and recognize that COVID-19 impacts Yukoners in very different ways. For instance, we know that communities are uniquely vulnerable. It's important that we honor community concerns and protect the Yukoners who call these places home. When you get outside and enjoy our gorgeous territory, do so responsibly and follow the travel advisories issued by First Nations governments and communities. They're available on the Council of Yukon First Nations Travel Advisory page, and you can also find a link on our yukon.ca COVID-19 site. Everyone has a role to play in this new situation. If you arrive at a recreation spot and it is busy or crowded, consider moving on to another area. If there's not space for you to set up 2 meters away from others, then it is not the day to use this place. I appreciate how hard that can be, especially if you've traveled a distance to get there. And we've seen these pressures at the Tagish Bridge, at Bennett Beach, at Pine Lake. Please remember, we are in this together, and together we can keep everyone safe, ourselves included. Please be respectful of our rural communities. Not all shops or restaurants may be open, and for those that are, follow their guidelines for safe interactions. I encourage you to check in advance if stores will be open, and if not, prepare to be self-sufficient. And always practice the campsite rule, leaving locations you visit better than how you found them. Be kind to yourself, your neighbors, communities, and our visitors. Soyez gentils avec vous-même, vos voisins, nos communautés, et nos visiteurs. Thank you. Merci. Masicho Ganashish.
Thank you, Minister Streicker. Thank you, Dr. Hanley. We'll move now to the phone lines, and we'll start with Tim from CKRW. Tim, we really can't hear you.
Hello? Test, test. Can you hear me?
We'll move on to the next caller. Oh, Tim's going to come out. Hang on.
Hi, good afternoon, Dr. Hanley. Nice to see you in person instead of through the window today. Just can you update the testing parameters? Like, how is that going? And have you had a chance to kind of look back at how the testing went as we've kind of gone through, it's been 4 months now. Can you give us an update on that?
Sure, I can give you an update, sort of off the top of my head type of update. So first thing is looking forward, that we are actually just in the process of finalizing some renewed testing criteria. So we're going to be, those will be integrated into the self-assessment process in about a week to come. And so that's really just expanding the catchment. It's actually not going to make a big difference to what we anticipate to be a low number of people coming in for a test at the moment. Again, just because of the lack of respiratory disease in the territory at the moment. But it does kind of position us for the future should we start to see with the fall an increase in sometimes the fall and winter associated respiratory viruses, that we have matching criteria to capture. And it's also a reflection of, as we are easing self-isolation requirements and easing border restrictions and anticipating that there may be more visitors coming in, more people traveling in, that we maintain a low threshold for testing for COVID. So that again, it's part of our strategy to stay ahead of spread by having generous testing criteria. If we look back at testing. So again, we've always enjoyed a number of advantages on testing and our testing capacity with respect to our close relationship with BC CDC labs, where we have, as a northern jurisdiction, we have a very privileged relationship with BC. So we continue to get a very good turnaround on our testing. So even though our swabs go out to BC for testing, we have a 1 to 2 day turnaround time for our tests. There have been questions about numbers of tests that we're doing. And as we know that nationally, there's a focus on getting people tested, especially in those jurisdictions that have had perhaps not optimal access to testing, or have not had that robust access to testing that we've always enjoyed here. So the reality is we don't have many people with symptoms. We don't have people coming forward to testing. That's okay. What's more important is a testing capacity so that we do have the ability to ramp up testing according to demand. And that's whether it's rural or white horse-based testing. And it's also the reason that we re-put in a smaller version of the respiratory assessment center, again, just to make sure that people know where to go to get tested if they need a test, and that it's as accessible as possible.
Second question for Minister Streicker. The rental assistance program, what prompted the extension, and is it a popular program? Can you give us any numbers about how many Yukoners are accessing that?
I think it's been a couple hundred. I'll have to check on the numbers, Tim, and I'll get someone to get back to you at CCRW. The reason is that, we had spoken with the Anti-Poverty Coalition. We'd spoken with the Yukon Landlords Association ahead of time, and we recognized that there was, under COVID-19, some pressures. And so we put in place the program. As with all of our programs, we worked hard to get them out quickly, and we always said that what we would do was review them over time. And so I think the program has been successful, and we felt that there's still impacts from COVID-19, and so we decided to extend it through to this fall, and we're happy to be able to do that.
Thank you. Thank you. We'll move now to Jackie, Yukon News.
Hi there. My first question is on elective surgeries and travel to BC. I'm wondering if someone's elective surgery is put off because they or someone they've been in contact with has traveled to BC, what the rescheduling process will be.
I presume that's a question for me, and I can't tell you exactly. That's probably getting a bit more detailed than I have the information for. But I guess you're wondering if it's put off, how long would it be put off for? And I'm sure that the provisions would be made, to accommodate that person as soon as possible. You could probably get more advice directly from the hospital, and we'll pass on the question to the hospital to answer that question. I think the key message, though, is really, and the purpose that I really wanted to get the message out was to make sure that people knew ahead of time, so that as you're planning your travel, you have that consideration in mind.
Follow-up question, Jackie?
Yeah, Minister Streicker, you shared numbers of how many BC residents had entered the Yukon. I was wondering if you have any numbers on how many Yukoners have traveled to BC or returned from travel to BC.
No, I don't have those numbers yet. I can get numbers for how many Yukoners have been coming back, but of course, I won't know if we don't ask them, did you travel just to BC right now? What we ask them is whether they have been staying just in British Columbia, because if they travel outside of British Columbia, then we're going to require them to self-isolate for 2 weeks. I can work to get numbers for you, but it'll be blended. I mean, one of the things that I think we can see, and what I've been watching for, is that I thought that as of July 1st, we likely were to see a bit of a bulge or a wave of people that had sort of a pent-up interest to come and visit. I think likely extended families, things like that, is where the first wave comes from. And then I saw it drop back down, or we've seen it drop back down, so I was anticipating that. I can take a look as well to see if that's also true for Yukoners, although they might have not waited to, they might have traveled after the first, so it's hard to know for sure. But we can look to see whether there's a difference with Yukoners coming back and whether there's any change to those numbers.
Thank you. We'll move to Mario, Radio-Canada.
Yes, my question is in French for Dr. Hanley. Donc, votre plan reste quand même assez vague sur la levée des restrictions lors de la troisième phase. Pouvez-vous peut-être nous donner une meilleure idée de quelles restrictions spécifiques pourraient être levées dès l'entrée en vigueur, donc aussitôt que le 1er août, si c'est en effet le 1er août, lors de la troisième phase?
So the question is for Dr. Hanley. Can you give us any idea of which restrictions will be lifted as soon as we move to phase 3 if phase 3 happens on the 1st of August?
So comme j'ai déjà dit, il y aura plus de détails dans 2 semaines d'ici. Donc, j'ai pas de nouvelles sur ça pour vous donner à ce moment. C'était juste une prévision pour répondre à une demande antérieurement pour avoir l'avis bien avant le moment. Donc, c'est maintenant la période de transition de 3 semaines anticipée. Et on va confirmer dans 2 semaines si c'est bien, si on est toujours bien en cours pour le 1er août. Et à ce moment, on peut peut-être donner plus de détails que ce qui est prévu pour le 1er ou ce qui est prévu pour plus tard. Donc c'est vraiment, mais c'est vraiment le début de la 3e phase qui était anticipée. I'll just repeat that in French. And again, to reiterate, it's, what are we thinking of happening on the 1st of August in terms of adjustments? And I said, there's more to come. Really, what I wanted to do was, again, after discussion with the Premier, to give an early warning that because that was what people had asked us, is really some advance notice of what are we thinking and what's the advance notice possible. So what we are thinking is that it would be suitable to begin phase 3 as of August 1st if we continue to do well through July. Which I anticipate we will, but we will confirm August 22nd with the Premier here, and at that time we'll be able to announce what kind of changes we're also anticipating according to the information we'll have at that time.
Thank you. Prochaine question, Mario?
Oui, donc quand on parle des frontières, quand on parle des différentes régions, est-ce que vous savez déjà s'il y a d'autres régions du pays qu'on serait prêt à ouvrir, ne pas demander l'isolation nécessaire?
So the question is, as we're contemplating opening borders to more regions, do we have an idea at this point which regions might be targeted by this reopening?
C'est difficile d'être spécifique. Naturellement, on a beaucoup de demandes de la part du public pour Alberta. Par exemple, comme c'est presque un voisin, c'est tout près. Il y a beaucoup de Yukonais qui ont des familles, donc on observe ça avec beaucoup d'intérêt. Pour savoir si on peut estimer que ce sera dans un bon état, mais c'est trop tôt pour dire concrètement que ce sera la prochaine. Il y a aussi des autres provinces qui sont à ce moment dans un très bon état. Donc on continue d'observer et on va revenir avec les détails plus tard.
Minister Streicker, no.
I'll just add that I think at all times Dr. Hanley works hard and works closely with the Premier and will make recommendations about those regions that where it's always a range of things. I think that Dr. Hanley works on that would determine what the situation is. And then I think he gives that to us as a government, and then we look to follow that evidence and take decisions based on that evidence. And I think, the conversations will naturally flow to those other jurisdictions. And I think right now it's good to see that we're on track and that we're heading in that direction. And I think we'll be working together in the coming weeks to, number one, watch to see that things continue to move in a positive direction. And number two, take those recommendations about what regions might be where we could have a difference in terms of self-isolation or not.
Thank you. We'll move now to Gabrielle, Whitehorse Star.
Hi, Dr. Hanley. You mentioned an importation risk assessment tool is being developed. Can you go into more detail about what that looks like and if there are factors outside epidemiology coming into play there?
Yes, thanks. So it really depends on. Of course, it depends on epidemiology. So that means what is the risk for one individual coming from a particular region, based on the number of active cases in that province, and then we look at what is the anticipated travel frequency. So it's really those are the probably two main components of the. It's really what's the expected number of visitors based on historical data versus importation risk. So those are probably the quantitative, but it also there are also factors such as how stable is the outbreak in a particular area. So of course there's a lot of instability in many places. South of in the U.S., if we look at Canada, we want not just reassuring numbers of active cases, but projections based on where the curve is progressing. So some assessment of stability at that level, and then whether it's an upward trend or a downward trend. So some of those considerations as well.
Thank you. A follow-up question, Gabrielle?
Is there any consideration of ending the state of emergency early, as we just saw NWT do?
Yeah. Thanks for the question, Gabrielle. I think we always are looking at the state of emergency, and it's always a consideration. I think that right now, one of the things that we use the state of emergency for is, for example, to ensure that Americans, as they come through, that they provide us a declaration, and that we can then, if we find them not adhering to that route, that we can ticket them or charge them. So there are things that are very important under the state of emergency. And I think at all times as a government, we continue to review it and ask for how we can pivot as we move through the phases. So I don't think we look at it because NWT is doing something. I think we look at it for ourselves and our situation here. And I know, for example, NWT just announced that they're ending it, but BC just reissued their state of emergency. So I think it is a question that we always ask ourselves. We always consider that we want to protect Yukoners, the safety of Yukoners, while doing so in a way which maintains everybody's rights and is is sort of the least restrictive that we can be at any one time.
Thank you. We'll go now to Philippe from CBC.
Can I go after this microphone? Yeah. Thank you. Hello, Dr. Hanley. I would like to ask about volunteers in hospitals and long-term care homes. On one hand, it's a risk to have people come into these buildings, but they also provide valuable services. When or what circumstances would you see to have volunteers welcomed back?
That's a great question, Philippe, and I don't know that I can really answer precisely for those facilities, because really what my position is we give, and it's similar to what Minister Streicker was saying about government decisions on borders. It's really providing the general advice, and then within their institutional considerations, looking at what traffic in and out, what are the benefits versus risks. The hospital I know has been looking at visitors and looking at overall traffic in and out, as it were, as it opens up to more elective procedures, specialist clinic visits, and other things. So these are actually significant considerations, because every person that comes in, although screened, does carry in a certain risk of importing COVID, and so I know that volunteers are on the list of considerations. I can't tell you exactly, but again, it's something I can bring back. And the same for long-term care. I know long-term care has different phases of reopening, including visitation, and where the role of visitors is, I can't tell you, but it's something we can perhaps bring back to you.
Then, would we perhaps see then decisions taken separately for Dawson City, Watson Lake, and Whitehorse?
I think that's quite possible. I think there would be a corporate policy first, and then it might play out in different areas, again, according to local considerations.
Thank you.
Welcome back, Philippe.
Nice to be here.
Thank you very much. Thank you, Minister Streicker. Thank you, Dr. Hanley. Thank you, everyone, for your time today. The next CMOH COVID-19 update is planned for Wednesday, July 22nd at 2 p.m.